Hello, everyone. So glad to have you here with us. If you're new to the podcast, thanks for joining us. If you've been with us before, welcome back. We're thrilled to have you. And I love doing these podcasts. I get to talk to so many interesting, wonderful people. And today, I have to say, is truly my favorite guest of all time because this is one of my favorite people of all time. This is my big brother, our COO, Chief Operations Officer, Dr. Margo Jacquot. So happy to have him here with us today. We're going to talk some about KPIs and which are key performance indicators. We're going to talk about those and just some other things that might help you as a business person, as a practice owner, as somebody wanting to go out into practice to know what should you be measuring and why. And then what do you do with that information? I talk on this podcast all the time about follow the numbers, use the numbers, make decisions by the numbers. How do we get those numbers? And then what do we do with them? So usually I introduce the guest, but I'm going to let my big brother introduce himself today, and then we're going to get started. So Mark, thank you. Well, first of all, for being my big brother. Secondly, for all that you do at the practice, because you're invaluable, and also for being here as my guest today.
Well, it's truly my pleasure, Margo. Thanks for having me. So, hello, everyone. My name is Margo Jacquot. I am actually an optometrist by trade, kind of to begin at the beginning. I spent several years in clinical practice, many more years on the administrative end of things with a company called Luxottica, for those of you who wear glasses like I do. You may
And I,
know Lens Crafters, Pearl Vision, Target Optical. And I was involved with overseeing doctor's office operations for North America. So US, Canada, all the way down through Puerto Rico. It was a wonderful, wonderful career experience. Got a lot of just sort of learn by doing knowledge that was very helpful. And then in uh, 2019, decided to leave Luxottica and started doing some consulting. And in 2021, Margo asked me to come and hang out a little bit and work on a few things with the Juniper Center, like expansion and growth and those kinds of things. And, my role, I think, has probably evolved from there. But Margo and I have always talked about the business end of practice, but now I'm really, up to my elbows, I would say, in the Juniper Center, and it's been a wonderful, wonderful time. I am, I feel so blessed to be part of a practice that does so many great things for so many people. There is just a huge, huge need out there, as you all know in the audience, and uh, I think what you do is heroic. You're out there working with clients. I know you carry a lot of weight. I mean, you're taking weight off of them and it's got to go somewhere. And that can be onerous. And I know at times it can be challenging to carry all that weight around. And oh, yeah, by the way, worry about how to pay the bills and grow the practice and do some things other than clinical care to make sure that you're able to do this as long as you want to do it. So I recognize those challenges. I faced them in the eye care field, and now I'm seeing that things don't change dramatically in the world of therapists. So
wow,
anyway,
right.
happy to be here, and thank you, Margo. But excited to talk about some of the things that maybe may help your audience be better, perhaps business people, run their businesses, their practices a little bit more efficiently. And I think the watchword for today is very overused, I guess, term, but let's work smarter. Figure out a way to work smarter, not harder. I
Not
think
harder.
that's our mantra because we all work really, really hard. But where does that effort go, and what's the return on that investment? So anyway,
That's
that's
it
why we're here.
exactly. That's
Yeah.
it. What a great segue. I mean, first of all, your ability to flex yourself and to become a part of this very different kind of culture. I mean, you were in a super corporate culture for a long time, and we're a large practice, but I think what you have found is that we have a very therapist-centric, client-centric culture, and you've just kind of slid into that so beautifully. I really appreciate that. But to your point, when I'm doing consulting with business owners and practice owners and folks, that's just one of the things I do. And Mark does some of this too. And sometimes we've done it together. We did it for a hospital system recently about, just trying to figure out how do they best support their business and their people all at the same time, which is what we're about all the time. So, um, but what I watch with folks is they don't know really what to measure. They get stuck in their fear. They get mired in the weeds. They're doing the do every day because they have to. I mean, I did all the do for a long time. Doing the do, that's your term. Doing meaning doing all of the functions because financially I had to. And I've said on this podcast before, as soon as I could hire somebody, I think it was, is her name Susan Blakely, the woman who founded the Spanx line of women's garments. I'm sure you're really happy to talk about that, Mark. But, she said, I remember listening to a podcast of hers or an interview of hers early on in my career as a practice owner. And she said, as soon as I could hire somebody to do what I can't do best, that's what I'm going to do. And so I had to be able to do that. And once I made my first administrative hire and offloaded some of the day to day functions, we started accelerating. I could put my foot on the gas. I could use my time differently. And each time I made those hires, here's billing. You take over the billing. You answer the phone, right? Including now having Hughes, who does a lot of just the day to day operational pieces. So I can think more strategically and work on projects that are really important to me and be kind of the clinical lead of the practice and that use my mind in that way. It's amazing. But to get there, and again, folks, I don't assume everybody wants to have a huge practice, but most of you, I think, want to develop and grow, which is why you're listening to this podcast. So, Mark, just start walking us through what would be a good place for someone who is, maybe trying to track, they look at their bank account, like we all do. I have money. This money comes in, this money goes out. I have QuickBooks. QuickBooks will tell me a little bit of a story. What Where should people begin if they haven't already done so? Where should they begin? What should they be tracking? What should they be keeping track of?
First of all, Margo, what you're describing is what is a very common phenomenon for clinicians, and that is um, working in the business and not necessarily having either the time or the ability to work on the business. There are only so many hours in the day. And by the way, none of us, we didn't all go to school for this stuff, right? You went to school to learn the human mind and behavior, and there's a lot that just is sort of learned by doing. I mean, fortunately, there's a lot of information out there now on the internet, but at the end of the day, I mean, how does it apply to me? How do I bring it into my own practice? And, I think first and foremost, Margo, you mentioned, I can't remember if you used the word fear, but, kind of the nervousness that, gosh, if I let go of something, is it really going to get done right? Is it going to
Quality
be done
control
correctly?
must be me.
Um,
Right.
and then, oh yeah, when I'm not in the therapist room, in my therapist chair, what do I
What am I
do out
doing?
there? Yeah,
Mhm.
well, yeah, and there's plenty of activity, but is it smart? Is it good activity? There's an author named Michael Gerber who wrote a book called The E-Myth, and in it, I believe he coined it. At least that was the first time that I had heard the term, making the time, creating the time to work on your business and not just in your business. And what that means is being able to do what you were able to do a few years ago, Margo, or several years ago, and that is to begin to delegate some of the things that could be delegated that didn't require somebody with their doctorate degree and all of the very impressive credentials that you have, um, to be able to do some of the work that could potentially be done by other people. And by the way, there are plenty of people out there on the administrative side that do a great job and do
That's
this
their skill
professionally.
set. That's
That's
what they're
right.
trained to do. That's their
Right.
experience, right.
So I think it. Oop, go ahead. Sorry.
No, that's it. I mean,
Yeah.
I'm not a biller. I can do billing, I suppose. I can press a button with the
Right.
best of them, but to get on the phone and to do all the resolution that's required, that takes a skill set. So, right.
Right.
So what are our
For sure.
skill sets and how do we use them?
Exactly. And how do we function as clinicians and assuming most of the folks on the call are either practice owners already or aspire to be practice owners. We're the folks with the entrepreneurial drive, with the business ownership mentality, and so that is a rare commodity, and there are plenty of therapists who are out there who just want to see clients and patients, and that's okay too. But hopefully, um, many of you at least have taken on an associate, and we can talk about that later. But I think the first step in in this process anyway is making that decision to go and that decision to let go, to be able to. And by the way, the I didn't clarify, but the E myth by Michael Gerber, E stands for entrepreneur, and the myth is that if I'm good at a task, if I'm good at doing something, whether it is conducting a therapy session, in my case, examining eyes, or baking pies. Ergo, I will be a successful business person. And I think we all realize there's a lot more to it than that. So the first thing is making the decision to go and deciding, and this is carving out dedicated time to work on the business. So now you've got the time, you're sitting at your desk. There's hopefully you're still busy. There's perhaps someone in the other room doing a client session as part of your practice. But the thing is, what do I do? What do I do with my time? Well, first and foremost, it's really taking stock of where you are. If you First of all, if you want to figure out where you want to go, it's good to know where you are right now. So, yeah. So, Margo, you mentioned the bank account. Of course, people usually know how much they're making in a week, a month, a year. Hopefully, what you're getting per session. I know it varies um, by insurance plan if you take insurance, but there's a good mix that you can get a bead on, an average mix of percentages of old Blue Cross or Aetna or fee for service, whatever, Medicare. And so knowing about what you're bringing in per hour of your time, and your time is extremely valuable, is really an important metric. Or, Margo, in the beginning, we use the term KPI, key performance indicators. At the Juniper Center, we call them key care indicators because they really are metrics. Yes, they're numbers, and sometimes the numbers can be a little bit befuddling and a little bit intimidating, but they really are a reflection of how good we're doing in terms of the care that we're providing, and how we are marking progress against last year or even last month, to make sure that we can do the good work that we're doing a year from now and 10 years from now.
So, yeah, Mark, I mean, so folks, I don't know when Mark said that he worked for Luxottica, he was in a high leadership role. He ran the doctor's offices for the United States, was in a VP role. So you really had a front row seat to major operations. So folks, this is, I mean, I benefit from this wisdom all the time, but when you talk about what needs to be measured and what people need to be looking at, yes, we start with our bank account. That's often one that I hear people talk about when I'm talking to them, other practice owners. Well, we seem to be doing okay, but I'm a little worried about payroll, or I'm not sure how we're going to make this work, or I need to provide this benefit. How am I going to do that? Or how am I going to hire people that are really good? And right, these are all the things that we're concerned about. But when we really dig down, what people want to do is move the needle forward. And I like to think, kind of to your last point, we want to do good, but to do good, we can also do well. And sometimes to do good, we need to do well because you need the capital to fund those good things that you want to do, that good care that you want to give. So, key performance indicators. Tell us about
Yes.
those.
Absolutely. So, if we think about kind of what drives our economic engine in the practice, first and foremost, it's the therapy sessions. And needless to say, I mean that's our bread and butter. That's really where the rubber meets the road. Um, Having a good understanding of how many therapy sessions you're doing in your practice on a weekly, monthly, and annual basis is really key to understanding where you are right now. If you've been tracking things for a while, then how are we doing against the previous year in terms of those number of therapy sessions? And y- assuming we're in the business of growing our practice, because we know costs are going up, rarely do insurance companies come out and go, guess what? We're increasing what we're paying you. That is not the case. Then we really have to be cognizant of the fact that in order to grow, we're going to have to do more therapy. We're going to have to do more therapy sessions, and we're going to have to see more clients. Now, we touched on having an associate before. If you're maxed out and you're the practice owner, you may say, gosh, I can't see one more client. This isn't about you necessarily seeing more clients or patients, but it is about the practice seeing more clients or patients, and that's where the associates come in. So the number of sessions that we do, number one, is a key care indicator that we track very closely. And looking at a growth projection, we like to keep that number between 10 and 15% year over year. So we know that we're growing. Revenues aren't necessarily growing. Gosh knows our costs are growing. So we've
Revenue
got to be
meaning the
able to.
amount of reimbursement,
Yeah,
because
yes.
revenue may
Well,
be growing, but reimbursement stays pretty
that's right.
static per
Yes.
per
Thank
client.
you.
Yeah.
Revenue per client is not necessarily. So that's one. The raw number of clients that you're able to see, um, tracking that and understanding how many active clients you have for a month or for a year is also an important KPI or key care indicator to track. So, how many clients you're seeing, how many client sessions or sessions per client, and the client's condition and your clinical preferences are going to determine, of course, the frequency with which you see those clients. Some people don't need to be seen every week. Many do. Um, some people get better, of course, and
Well, let's
can
hope.
can leave
Yeah,
the
right.
practice. Let's hope. I
Yep.
mean, that's the goal. But at the end of the day, I mean, making sure that for every, ideally for every client that drops off or patient, we get another one waiting in the queue to get in so that we don't miss a beat. So that's really key. Taking a look at, as I mentioned before, your revenue per session, I think that allows you to connect the dots between the number of therapy sessions that you're doing and the top line revenue that's going to be coming in for the practice. Clinical product or clinician productivity. Now we do look at that. We have 80 therapists on staff, and with that, it's a mix of psychiatry, psychology. We've got LCSWs and LCPCs, LMFTs. I mean, it's really a very diverse group of skilled and very talented, passionate people. But also, with that many people, as you might imagine, we've got a lot of therapy sessions. We've got 7 locations plus telehealth, so we've got a lot of people coming in and out, and making sure that we are helping our clinicians stay productive is really key. So we do track clinician productivity, and in our practice, we've defined full time as seeing 25 client or patient facing hours per week. We believe that the other 5 or 10 hours or whatever in the week are going to be spent with note completion, signing off and locking notes, treatment planning, and that sort of thing. So our average therapists who are working with us full time are probably working about 30 to 35 hours a week. Some do more. That's by choice. That's not, we certainly don't ask for that. But in order to be able to stay competitive and provide benefits and that kind of thing, we want to make sure that folks are being productive. And many of them have student loans. We want to make sure that people are not having to look elsewhere for a client base, and and we'll talk about how we do that. But making sure that we have enough clients for each of our therapists, even if you've only got one associate, I'm sure you want them to be busy. And then another metric, another key care indicator is client retention. How many of those clients, as we mentioned earlier, yeah, some are just going to get better, and I mean, we're gonna encourage them to do well, and hopefully we're bringing somebody else in on the heels. But one thing that we do see, particularly with newer therapists, is turnover tends to be a little bit higher. And some of the things that we've encountered
Meaning I'm sorry, not turnover of them as a staff member, but turnover of their clients. Like,
of their clients, right?
right, the
Talking, yeah,
more
in the
so
vein
the
of,
longer someone works, the more skilled they are at being able
right.
to keep a
Yeah,
client sort of engaged in the process if they need to be. Yeah,
exactly.
sorry.
Exactly. So client turnover can be an issue with a newer therapist. The population that you're seeing, sometimes insurance plans will only cover so much, so many visits. So, I mean, there are a lot of variables in there, but if we start to look at trends, and that's, one of the benefits of tracking the things that we're talking about, is that you're able to you start to look at the way the numbers kind of fit together and flow and trend, and you're able to make really good informed decisions based on that. So if you have a newer therapist who's having a little bit, and what does that look like, by the way? How do you track it? Well, we track in terms of retention. If a client is with that clinician for 13 weeks or more, we call that a retained client. If the client, and we just picked a number somewhat arbitrarily, but based, feedback from our own therapists and some of our leadership, it's a good average to look at. So if we start to look at that as our barometer for retained, and we have a newer therapist who maybe, instead of retaining, call it 70% of their clients for a 13-week period, are retaining 20 or 30%, maybe even 40. Well, that's room for a conversation. And, we, of course, don't want to overstep. I don't get involved in those conversations because I'm not a therapist, but this is where Margo and her team of very capable clinical managers step in, and they're able to have the conversations. And oftentimes, it's really just a dialogue and understanding when that newer therapist is cutting people loose, for lack of a better term, or letting them go. We've heard from one new therapist, I just don't know what to say anymore. I think I'm
Hey,
done. I'm kind of out. And
right.
some of that's confidence, some of that is certainly experience. And, I'm happy to say that this one particular clinician is doing very well right now after just a couple of conversations with Garrett, one of our clinical managers, on better understanding ways to engage clients maybe on a deeper level, and the need to be able to, for lack of a better term, I think justify, but certainly making it meaningful clinical time. And in doing so, ensuring a better outcome in the long run. That's really important.
That's right, Mark. That's a great example of, okay, so great. We're going to have key performance or key care indicators. Great. How many people are our clinicians seeing? Why do we need to keep track of that? Well, we need to, if somebody's full time and they're getting benefits from us, we have to make sure that they're meeting the threshold that the insurance company that we're providing insurance for them, they're meeting that threshold. But something like this, with all of these, our goal is to be as supportive of clinicians as we can be. This isn't so that we're gathering data to make a case against somebody really ever. The idea is, if you are, so that's a key performance, key care indicator. How are you doing in terms of your retention? And, there's a phrase, churn and burn, right? I mean, we've all heard that. And we have had some clinicians who will come and say, oh my gosh, I don't have enough clients. Like, how can that be? We've heard like 40 people to you. Where'd they go? And, having been a therapist for, 3+ decades, I kind of have a much better sense of the cadence of the work. Some people come in, they just need a little bit of work and then they're fine to go. Most people, 13 weeks is an underestimate. And if people are losing that client after 13 weeks because the client's sitting there saying, "Well, I don't know what else to say," and the therapist is saying, "I don't know what else to ask," then that's important for us to say, "Okay, here, how can we support you as a therapist? What else can we give you? What other training do you need? What other consult?" It's usually consultation. That's the biggie. So, an individual consultation. I know a lot of practices do a large group consultation, but those are people that will kind of pull out and say, "Okay, here, let's do more individuals." So, to your point, how do we take that information and what do we do with it to better the work that we're all doing?
Well said. So that's, and without, again, it leads back to the data. Without the data, we don't know to have the conversation. We're not listening in. We're not recording sessions. I mean, we're not about that. And it is, Margo, I think you brought, you put it into an excellent context. We're coming at this from a position of support. We ask the question, how can we help? What else can we do? And helping those, in some cases, newer clinicians um, get a little bit, sort of flatten out their learning curve a little bit and help them get into the fold of things a little bit sooner, and they'll be happier. They're having more meaningful conversations with their clients. They're engaged. They're more engaging for their clients. And so, yeah, therapist development is a big part of what is done at the Juniper Center.
So, what else should people be keeping track of? So, we've talked about a few, right? Number of sessions, client retention, those are biggies. Um, Another one for us, we track if people are getting their notes done. I mean, that's a pretty big one. And I think none of these sound like wildly out of what folks are probably looking at currently, but what else should they be tracking and what should they do with that data? How do you keep track of the data, not just use your gut? And then what else should they be doing with that data?
Yeah. So we've got a number of systems and processes and forms that we've developed over time. If you know how to use Excel, and if you don't, that's okay. It's some of these are very intuitive, but we're tracking them that way. And the idea is, number one, you track them. Number two, what are those data points over time will tell a story. And so are we seeing, for example, an increase in over time in the number of sessions that we're delivering as a practice? Well, that's a good thing. If we start to see things dropping, well, we're going to be a little. Unfortunately, we haven't. Um, Certainly not recently, not post pandemic or even during the pandemic. But they're becoming a little bit more difficult, and I think to acquire new clients. And we don't have people who are necessarily lined up at the door any longer to get in. They know who we are, and yes, many of our clinicians have waiting lists. But we've had to really put on our thinking caps and get a little bit more creative in terms of marketing. The good thing is, I mean, social media is readily available. Google My Business is a great way. I mean, kind of table stakes anymore is you need a website and you need a Google My Business account. Google My Business is free. A website can be designed now. There are many, many sites that'll vendors that'll help you design a website for very little money. I've known a therapist who's got a very successful practice whose neighbor's daughter who was, I think, a high schooler, were getting ready to go to college, put their website together. So, if you're not great at it yourself, somebody else can. But it is, in terms of what do you do, that we track that kind of information over time, and then it allows you to plot what's happening. And if your growth is on trajectory and on target, great. Hopefully you're doing some things right. Client retention will tell you a story not only of quantity but quality. Are we doing good work? Are all of our associate therapists delivering awesome care, or do some of them need a little bit of help with their perhaps communication skills? So we can help with that, but all that is driven and guided by the data. It's very important that we're tracking that. So again, it can seem a little mundane, maybe even drudgery to some, to begin to, oh gosh, that's not what I'm about. I take good care of my clients, and I'm sure that you do. But if you're in growth mode or you want to be in growth mode, I gotta say that's the only way that I know to get there. That's to track some of these numbers, and then look at them over time and look at the plots and see where things are going. If things are going up, great. If not, well, what can we do differently? We look at it now. We're taking a look at client growth, not only for the practice, but also by location. And if in a certain location we had issues initially, I wouldn't call them issues, but I'm going to be very candid with the Lakeview area. And, we
Lakeview
didn't
is a
have,
neighborhood in Chicago, folks. Sorry for those of you who
oh,
aren't from the
yes. Yeah.
Chicago
Sorry
area.
about that. Yeah, I
It's a kind
realize.
of a hip, younger. I don't know. I may sound old saying it's hip. It's kind of a younger, uh, urban area that people really enjoy being there. Lots of
Right.
restaurants, cool bars. It's very close to Wrigley Field where the Cubs play. So,
Hmm.
um,
Hmm.
so it's that kind of area.
Very, very true. And so we didn't, we having a really, I think, good reputation in the locations where we had been. I'll call them legacy locations in that they'd been around for a few years. They were bustling, but we opened up in the city in this near north side area called Lakeview, and we're right by Wrigley Field for anybody who knows who's been to a Cubs game. But we're 2 blocks from there. But the demographic is very different. The vibe is very different. And you know what? They didn't again, people didn't know who we were. They didn't know, and we struggled a little bit, particularly with some of the newer therapists that we'd gotten in there. We were very fortunate to have brought on or affiliated with a therapist who had a marketing background, Sarah Griffith. She's awesome. They're awesome. And so through collaboration with Sarah and the rest of the therapists down there, we really kind of put together our own Lakeview marketing plan, which included, yes, social media, yes, a dedicated page for Lakeview on our Juniper Center website, which, by the way, if some of you have not visited it, it's a wellspring of resources. And aside from the CEUs, the continuing education units that we charge a small amount for, everything on there is free. And if you don't want CEU credits, you can watch all the videos you want for free.
For
So we've
free.
got a really well curated library of clinical topics and business topics that could be of interest to you. And I'd encourage you to go there if you like. But anyway, we put a dedicated page for Lakeview with all the therapist bios on there and all of their smiling faces. We did some outreach in the community. We got out and beat the street a little bit, visited some practices, some local practices in the area. Compass was one, and developed relationships, referral relationships with those folks. We also started working with ZocDoc recently, which in the inner city population is a little bit more. You've got folks that are pretty tech savvy. Everything's done with a smartphone, so they're on there booking appointments through ZocDoc. So it caused us to become a little bit more creative in our marketing approach. And in doing so, right now at Lakeview, we're bursting at the seams in that we have more clinicians that want to be down there and more clients that we want to see than we can hold. Right now, we're working to expand our space by another 50%. And I suspect in another 3 to 5 years, we'll be growing yet again. So
Yeah, just
it's a good
really
problem to
the
have.
it's a good
I'm sorry.
problem to have. But,
Yeah.
to
Excuse me.
your point, Mark, if we weren't tracking, so here's the I love this, that the numbers tell the story. That's one
Right.
thing you say, right? The numbers have to tell a story. The other thing you say is there can be a lot of, you have a great quote. I don't know if it's a Yogi Berra quote, but, we're doing a lot, but we're not. What is, you can tell me
Yeah,
the
we're
quote in
lo-
a
we're
minute.
lost, but we're making good time.
But we're making good time. That's
Yeah.
right. And KPIs will help you folks not be lost, right? There can be, to your point, a lot of activity. And so using those KPIs to expand Lakeview as a really good example, we could look at data. What's happening? How many clients are we needing down in this location? How many clinicians? When do we know we need to start looking to hire somebody? And that's all by looking at the story of the Lakeview location data. So, folks, that's partly why each decision that we make to move, now we're moving to expanding to new space. We knew it was the time. How did we know? We had the data, we had the numbers. Without that, we would have been guessing. And I'll tell you, I've done a lot as a practice owner, probably as a human, based on my gut. Like I feel like I have pretty decent gut instincts, but I'll tell you, these days I'm really glad to have the verification. And sometimes it's, guess what, folks, more accurate than I am, um, about what is the timing. What do we need to look at? What is the threshold? Okay, as soon as we have this many client visits in this location, it would justify hiring another person. So, folks, that's part of the reason why. So, really, as you're trying to move that needle, activity alone, um, glancing at the checkbook, those really are not going to give you the information that you ultimately need. So, Mark, this is really good information. Can you think of just what are the top three things you would want folks to remember about measuring the data? And you know what? I'd love to have you come back soon and talk about HR processes because, folks, we are all up to our eyeballs in HR these days, which, boy, I didn't learn anything about that in school, and I suspect you didn't either. So, but for today, what are just the top three things you'd like our listeners to take away for today?
Yeah, I think one, it is at a point we all have to make the time, a conscious effort to deliberately work on our business versus in the business.
How do
Get
I
out of the
afford that?
therapy lane. Pardon me.
Sorry, I asked you for 3 and now as your little sister, I'm interrupt. How do I afford that, right? That I can hear it. How do I afford it? I would say, folks, how do you not afford it? You can't afford to not afford it. You need to figure out how to find somebody on Fiverr, on Upwork, somebody, a fractional assistant, something who will help you be able to work on the business, not just in the business. Strategy, tracking, all of those things, not just supervision, folks. This is business acumen. So, sorry. So that's number one. Number two,
Yeah. So, secondly, don't be afraid to delegate. Find someone who is an extension of you, who can do what you do, and if it's calling clients back, if it's doing your billing, a lot of that can be outsourced. There are billing services. Upwork was mentioned earlier, and Upwork is an excellent source of affordable temp labor. And some you've got folks out there that are very eager to help, and in a virtual world can do so from just about anywhere in the world. And so we've actually used a few folks here or there from Upwork to actually help us build some of the tracking that we have. And then I think the third thing is start looking at the numbers. There's an old adage that says what gets measured gets managed, and you have to be looking, you have to be tracking, and you have to be looking at things over time. It's almost, it's really getting out of ground or up from ground zero and looking at things from a 10,000 or 50,000 foot view, and really looking at how things are progressing, how things are growing or not growing, and then where can you make informed decisions about your practice to keep yourself moving on track, informed choices based on and driven by the data. That is really important. So, in terms of, I think as long as we're talking top threes, I think if I had to pick three, let's say 3 to 5 KPIs or key care indicators, top line revenue. So, is my top line revenue is the money that I'm bringing into the practice, and that's after discounts for insurance and write offs and everything else. Is that growing month over month and year over year? Okay, hopefully it is. That's one. Two, what drives that? What drives that economic engine? The second key care indicator would be the number of therapy sessions that you're doing per month and year, and that should be growing year over year. Third, the number of clients that you're seeing. Kind of goes without saying, not everybody puts a number to it. So look at those clients, and are you seeing more clients? And then it's not necessarily seeing them more frequently, but it may be, again, if you have that newer therapist on staff who may be turning, or as you said, Margo, churning and burning them inadvertently. Um, and then client retention is another very useful for us in general. I think whether we have an associate or not, but are people staying with us or are they moving on? And are they moving on for a reason? We talk about people during the pandemic. We talked about people and even quiet quitting. Do we have clients who just happened to go away? We don't know why. They didn't tell us anything was wrong, so we assume things are okay. But were we really ready? Were they ready to move on, or are they just not finding what they need at our practice? And what can we do about it? I think more importantly, all those require a little bit of a higher view, looking at things from a more strategic vantage point, and at the end of the day, making good choices based on that data. Um, so we have, by the way, I can put a plug in, Margo, for you and as the mental health business mentor, but we have a number of systems that we would be happy to talk to people about. and help implement. So if folks are looking for ways to track, if maybe you're just, and it's okay, not a numbers person. Again, we didn't go to school for this stuff. There's a way to do it, and we can help someone put systems together, tracking systems, analysis tools that will help you become smarter about your business, so that hopefully you're working not harder. In fact, hopefully not working as hard, but working a lot smarter and getting to where you want to be a lot quicker. So that's,
Absolutely.
yeah,
I
that's
would
we're here for you.
We are here for you folks. That is true. And I'll tell you, once we had a lot of these systems in place, I could then take that step out even further of the day to day. And I feel like the impact that I get to have in my life is so much greater. What I get to do, the things I'm choosing to do, the boards that I sit on, the consultation I do for people, all of those things, I never would have had time for them. I wrote a book, for crying out loud. I mean, I have time to do the things that feel important to me, and still meeting with everybody who's an important player in our administrative staff, of course, but it's more in a consulting role versus I have to go do it. So those systems, folks, will allow you to grow, to prosper, to do good and to do well, and also to have that discretionary time. But you
Mhm.
have to have the numbers, because numbers will help you deal with your fear. Coming back to where we started, so many people, so many practice owners have fear. Nobody's going to do it like you do. Nobody does it like I do. Okay, well, Mark does. I mean, probably the closest to it is genetics, I guess.
I
But
can't do what you do as a therapist, though. No way.
well, there's that, but,
Right.
so folks, those I think are great takeaways. So, Mark, as always, I think this is your fourth time or fifth time on the podcast. Thank you for being here. Will you come back soon and talk to us about HR? Because I think you're doing some beautiful things in our practice around HR, and I'd love to
Yeah, I'd
share
love
those
to.
with our
Yeah,
listeners.
and thank you. Thank you for having me, Margo. I
That
always
would be
enjoy this.
great. That would be
Always a
great.
good
Well,
time.
folks, thank you for joining us. As always, please come back again next time. We look forward to having you. Be well.